Hi, my name is Barbara Dipietro. I'm the Policy Director at the National Healthcare for the Homeless Council. I'm also in a dual role where I'm the Policy Director at the Healthcare for the Homeless grantee in Baltimore, representing homeless healthcare in Maryland. One of the things that we think about with the current healthcare system in America is the fragmentation that we're currently under. And when we think about single payer, and we can't really do that without comparing what the current system is that we're currently operating with and some of the fundamental failures that this system of care has provided for people living in this country, and then what are the benefits to single payer moving forward. And right now there's clearly a lot of policy unfolding with the Affordable Care Act and what that might mean, and then what opportunities that might offer in going forward and considering single payer developments in the future. And so when we think about where are we now, we've got a system where we have 300 million people living in this country, 50 million of them have no health insurance. So what does that mean when it comes to lost productivity, the risks of bankruptcy, the individual and family toll that this takes on folks? That's for folks who have no insurance, the constant worrying about something that might happen, or in some cases, people who aren't thinking about what might happen should an illness, an unexpected accident, or anything could happen at any moment, and then the risk of financial ruin, particularly for people who are young, who fall into the category of generally don't think about it. This could ruin your life and bankrupt you for decades. We have people who are raising families, they're working, and something happens, you get sick, you exhaust your health care, exhaust your leave, and you're no longer able to work. So we see that typical sliding pattern of people who lose their employment, lose the connection to employer-sponsored health insurance, and then you have yourself unemployed and uninsured and with health care conditions, with no income. Of course, then the bills just pile up. In 2007, there were about 1 million personal bankruptcies. 62% of those were caused by medical debt. When we look at the economic impacts, let alone the healthcare impacts, but the economic impacts of lost productivity, lost wages, at a time when we are looking at our employment patterns in the country, we're putting an emphasis on jobs, we're putting an emphasis on personal responsibility. We're really placing people in a catch-22. Because people can't work if they're sick, and you can't get care unless you're working because of the tag to the employer piece. So this is one of the catch-22s that we have in the current system that doesn't serve everyone well. Meanwhile, we have about 20 million people who have insurance, but the insurance doesn't cover what they ultimately need care to receive. So for instance, if you have diabetes and you have a healthcare plan that covers everything but your diabetes care, perhaps this is a pre-existing condition or something that your health insurance isn't covering, well then you're still left with those out-of-pocket expenses that can really rack up quite quickly. So we're seeing really a substantive number of people in this country who are struggling to pay for health care. Even with people who have got low incomes, even if you might have health care, people have reached annual limits, lifetime limits, deductibles, co-pays, all the things that really contribute to those out-of-pocket individual expenses. Right now in this country, we're spending about $12,000, $13,000 per year per household for health insurance in this country. And that's more than twice the next most expensive country in the world when we look at any other country we would want to be compared to. And I think that's one of the frustrating things, is that when we look at what we're paying into the current system with all its flaws, and when we look at the outcome measures of the quality of care, the access to care, the coordination of that care, we're actually not getting what we're paying for. And so I think there's a frustration when I hear people say the United States has the best healthcare system in the country. That's not accurate. It would be accurate to say that we have some of the best medical technology that the world has to offer, but that technology isn't even available to everyone living in this country. It's only available to very well-insured people who then have access to cutting-edge technology. Certainly we have examples of people flying to the United States for very sophisticated technological advances in our medicine. So certainly we could see that. But when we look at a healthcare system is more than just the technology that's available to you. It's a system that includes you as a patient, It's a system that looks at the outcome measures. It coordinates your care. It's something that you're satisfied with. It's something that meets your healthcare needs, not just when you're sick, but it looks at you as a whole person and ensures your wellness, not just your sickness. And so when we think about where we are and where we'd like to go, this is where we're starting from. And so this is one of the frustrations, is that we have to be honest about the current gaps and limitations of what we're currently working with. The Affordable Care Act tries to fix a number of those pieces, and I'm a proponent of the Affordable Care Act. I'm hoping that we can go forward with some of these measures, but I think one of the fallacies that we need to get away from is that the Affordable Care Act actually fixes some of the fundamental problems in our healthcare system. I don't think that it does. Certainly it expands healthcare insurance for 32 million people. This is the anticipated number, about half through Medicaid expansion, and then half through products that are offered in the state-sponsored exchanges. When we think about what that looks like, though, we still are looking at a fragmented system. We're still looking at a system that's largely siloed. We're looking at a system that doesn't take any of the profit motive incentives out of the way that we provide care that we have now. And so, sure, there's emphasis on patient-centered medical home. There are initiatives to do accountable care organizations, health homes. These are all initiatives that are trying to force the system to do the partnership, the collaboration, the communication that's needed in order to actually provide a coordinated quality system of care for an individual. But we don't know whether we're going to get there or not. Right now, that's all in theory. Right now, we're testing out some of these models. We're seeing if they work, but we don't know. Ultimately, though, it's about how do we save money, right? Because at the same time that we're not getting very good care, we're also really running an incredible deficit. Now, the deficit is powered by a number of different factors, not having anything to do with healthcare. In fact, the two wars that we're in and tax cuts that are unsustainable are a significant contributor to our current deficit. But we can't ignore the impact of rising healthcare costs on our GDP and on our deficit and on where we're projected to go in the next 10 years, absent some fundamental change. So certainly I understand that the Affordable Care Act, its expansion of insurance, that insurance will absolutely provide some savings down the road, as you're at least ensuring a continuity of care for people who would otherwise be absent any insurance. So that's all good. But what we're thinking about in terms of the profit incentives, it's still about the money. It's not necessarily about the care. And so when we think about, even in the Medicaid system, even in the public insurance system, we tend to forget that the people who are delivering care in a Medicaid system are still largely working for for-profit insurance companies. Medicaid is not any different than any other insurance company in that regard. So absolutely you do have a non-profit sector of managed care organizations, but about 60% of them are still publicly traded for-profit entities. So essentially the Affordable Care Act has put 32 million new customers into the existing insurance pie, right, or into that existing insurance pool. So again, we're still motivated and driven by profit and by the underlying economics that go along with it.